Good morning, everyone, and thank you so much for joining us for this afternoon's webinar. We wish to inform everyone that for the panel discussion that will commence this afternoon, all questions and comments should be directed in the Q&A box for those in the meeting room and to the comment section for those live streaming with us on the UNDP Facebook page. Again, this activity is being live streamed and recorded via the official UNDP Facebook page. Thank you so much, everyone. Welcome to Across the CHASM, Informing Communication Strategies for Vaccine Acceptance Through Data Science. This webinar is being hosted by the United Nations Development Program in the Philippines in partnership with the National Economic and Development Authority, the Department of Health, and the Analytics Association of the Philippines. We are honored and grateful that you have taken the time to join us today. My name is Charlene Balaan of UNDP Philippines, and I am your host for this afternoon's webinar. With the introduction of a number of effective COVID-19 vaccines in the Philippines, advocating for vaccine acceptance, social and community support for vaccination, and combating vaccine hesitancy are key to achieving significant outcomes in mass immunization programs. Community mobilization and social and behavior change communication interventions can be effective strategies in promoting vaccine acceptance in the country. Through UNDP's Pintig Lab, both traditional and non-traditional data have been used to determine specific communication strategies for various personas to encourage vaccine acceptance. These strategies may be considered by local governments for their implementation of their COVID-19 vaccination programs and also by other stakeholders as well. To formally open this afternoon's program, we will all hear from the resident representative of the United Nations Development Program in the Philippines, Dr. Selva Ramachandran. Dr. Ramachandran, a Malaysian national, is a seasoned development practitioner. Prior to his appointment at the UNDP Philippines, he served as the UNDP resident representative and country director of UNDP Sudan, UNDP country director in Libya, Chief of Northeast Asia and Mekong Division at the Regional Bureau of Asia Pacific in New York, and UNDP Country Director in Yemen. Esteemed guests, allow me to turn over the floor to Dr. Selva Ramachandran. Over to you, Dr. Selva.
Thank you, Cha. Good afternoon to all the panelists and participants who join us today in this important webinar. Today's topic on COVID-19 vaccine acceptance is quite timely and important given the current situation. It has been over 18 months since the world witnessed the battle against this pandemic. During this period, major advances have been made in the understanding of COVID's modes of transmission, epidemiological trends, vaccines, clinical management, development of point of care, diagnostics, and treatments. Alongside public health measures, vaccination is key to controlling the continuous spread of the pandemic, and I'm encouraged to see the progress we are making in the rollout of nationwide vaccination program in Philippines. The Philippines is accelerating the implementation of its vaccines program. As of August 15, 2021, the government has reported that around 27.8 million doses have been administered. Around 15.2 million individuals have gotten the first dose, while around 12.6 million are fully vaccinated, with highest shares observed for A3 category, the persons with comorbidities, and A2 category, the senior citizens, respectively. Philippines is proactively attempting to reach the targets for the A2 and A3 groups by boosting availability of vaccine and increasing vaccine acceptance. In July, it has been reported that the Delta variant of the coronavirus has been detected in the country, a far more contagious variant that threatens to put the country into lockdown again. Thus, we are now in a crucial time. It is most important that we work together to enhance the COVID-19 response and management by accelerating vaccination as part of our broader strategy. The best way to fight this mutating virus is to vaccinate the population. Vaccine supply remains a key challenge across the globe, but countries are working with the WHO to find innovative solutions to increase availability of vaccine. While acknowledging this major challenge, several countries are concurrently facing challenges related to vaccine acceptance. As vaccines are being rolled out, misinformation about vaccine has continued to spread, affecting the level of vaccine acceptance among the general public. WHO has termed this phenomena the infodemic, or an overabundance of information, some accurate, some not, that spreads alongside a disease outbreak. I'm sure many of you are gathered here today have come across vaccine-related infodemics, which were proven to be not accurate. Finding solutions to the infodemic is vital for saving lives for COVID-19 as public health measures like wearing masks and hand hygiene to equitable access to vaccines, treatment, and diagnostics. When it comes to vaccine acceptance, it can be affected by many factors. During a time when opinions are quickly changing, people need to be well informed with accurate and timely information. Mainstream media, social media experts, leaders, key influencers, and even our families and friends may drive these opinions. How we trust one another may also determine our attitude or behavior. We think about the vaccines, safety and effectiveness, perceptions that they might not be free or needed, or that we think some brands are better than others. All these are intertwined. Understanding human behaviors and adjusting our communication strategy to promote widespread acceptance is key. UNDP, in close collaboration with NEDA, has commissioned a study to deepen our understanding of the factors behind vaccine acceptance in Philippines. Here, we applied innovative methodologies to generate insight for community mobilization and social behavior change communication interventions, which could be an effective strategy in addressing vaccine acceptance. WHO and UNICEF further helped in enriching the analysis within the expert guidance. I wish to extend our sincere thanks to Rockefeller Foundation that supported us in conducting this study and the other work on data for decision making. This afternoon, through Mr. Dominic Ligot, our lead data scientist for our advanced data analytic lab called the Pintic Lab, will highlight the findings from this research. I'm also very happy that we are joined by esteemed speakers and panelists. They will be properly introduced by the moderator. I'm eagerly looking forward to hearing their views and the discussion of this webinar. Once again, thank you for your time, and may this session be fruitful and useful for all in our work towards responding and recovering from this pandemic. Stay safe. Thank you.
Thank you so much, Dr. Ramachandran. And as Dr. Ramachandran has stated, during a time when opinions are quickly changing, people need to be well informed with accurate and timely information. Understanding human behaviors and adjusting our communication strategy to promote widespread acceptance is key in our response. For our next speaker, today we are also honored to be supported by the Department of Health, one of UNDP's most steadfast partners. Our first presenter is Dr. Maria Rosario C. Vergara, the current OIC Undersecretary for the Public Health Services team and the official spokesperson of the Department of Health. She was previously the OIC Undersecretary for Health Regulation team and Assistant Secretary in charge of the Public Health Services team. She also acted as OIC Deputy Director General for Field Regulatory Operation of the Food and Drug Administration, Office Director of the Health Facilities and Services Regulatory Bureau, and Chief of the Health Research Division of the Health Policy Development and Planning Bureau. Here we have the honor to present Undersecretary Maria Rosario C. Vergara to present an overview of the COVID-19 vaccination rollout in the Philippines. Over to you, Undersecretary.
Thank you very much, Charlene. Good afternoon to all of you. Of course, good afternoon to Dr. Selva. Thank you for inviting the Department of Health to this webinar of UNDP. Good afternoon to our partners from WHO, from World Bank, of course, Governor Dax Cua from ULAP, Dr. Nina Castillo Carandang, our expert, part of our expert teams from DOH. I am joined today by Director Nika Hao and Dr. Alfonso Regala, who's going to do the question and answer for us, as I need to go to IATF immediately after my presentation. So can I have my slides, please? Next slide. So let me begin our discussion by giving a brief situationer of COVID-19 in our country. As of August 18, 2021, the total reported confirmed COVID-19 cases in the Philippines is at 1,776,495, of which 5.92% are active cases, 92.3% are recoveries, and 1.72% are deaths. Looking more closely at our active cases, 97.9% are either asymptomatic, mild, or moderate, and 2.05% are severe and critical. Given our epidemic curve, we saw a decline since our peak in cases in the first week of April. Since May, however, cases started to rise slowly again, and now our cases are rising at a faster rate. To date, the week of August 5 to 11 had the highest number of new onset cases. The National Capital Region, which are the green bars, have the highest number of cases in the recent 14 days, followed by Region 4A, which are the gray bars. The COVID-19 pandemic constitutes a significant challenge to the Philippine healthcare system. Although no country was spared in this global health crisis, it has undoubtedly highlighted existing gaps in our healthcare system. During our response to this pandemic, we remain cognizant of the fact that our resources are limited, and as such, prioritization must be done. This must exhibit fairness and transparency. Supposing that there may arise conflict of rules and guidelines, human dignity and the safety and the needs of the individuals shall prevail. Let me underscore the guiding principles of the national government's response against the pandemic. The crucial concept for the COVID-19 response is to embrace that this endeavor is one that requires a joint effort between the national and the local governments, and that it should espouse the whole of government, the whole of system, and the whole of society approach. Therefore, all unnecessary information from all sectors are welcome. All necessary information from all sectors are welcome, including those from the non-government partners and civil societies and our development partners. Evidence has steered and shall continue to direct our decision-making, from the institutional down to the individual levels. This shall empower every Filipino in making informed health choices to protect themselves against COVID-19. With our rising number of COVID-19 cases and the presence of the variants of concern and variants of interest, the Philippine government has activated the Crisis Action Plan, which uses the Fourdoor strategy. This provides the framework for the National Emergency Operations Response Plan in the prevention and control of emerging infectious diseases. It embodies a set of operational guidelines that will ensure a complete and detailed rundown of actions to be taken at 4 distinct points of doors of intervention to prevent and minimize the entry and the spread of emerging infectious diseases and to mitigate the possible effects of widespread community transmission. The Department of Health underscores that with our Fourdoor strategy, we have delayed the entry of the Delta variant with the activation of our doors 1 and 2. Through travel bans and restrictions, which targets the transmission from the point of origin to strict screening, quarantine, and testing at the points of entry into the country. Now that the country has detected local cases of the Delta variant, doors 3 and 4 are being activated. Door 3 involves strengthening the implementation of our PDI-TR+ strategies to prevent further local transmission. PDI-TR+ stands for prevention, detection, isolation, treatment, reintegration, and vaccination. Door 4, on the other hand, will prepare and ensure that our healthcare capacity is ready for a wide-scale community transmission by enhancing our PDI-TR+ strategies at all levels. Since we are seeing a rise in the number of cases and have the presence of the variants of concern in the country, we have to ensure doors 3 and 4 are further strengthened to win this race against the COVID-19 and its variants. The national government is providing assistance to our local government units to strengthen the implementation of the PDI-TR+, which includes immunization strategies, and for us to prevent further the transmission of COVID-19 cases. With the discovery of the COVID-19 variants, there are a lot of information generated. Hence, aside from the actual implementation of this PDI-TR+ strategy, we in the Department of Health had to ensure that all of these actions are being communicated well to the public to lessen uncertainty and anxiety of our kababayans. We had been increasing our vaccinations and continuously securing a steady and stable supply of doses. But we have to know first why everyone needs to get vaccinated against COVID-19. COVID-19 vaccines mimic the SARS-CoV-2 that causes COVID-19, and it triggers the body's creation of antibodies and activation of our cell-mediated immunity. These antibodies and cell-mediated immunity will protect the body once a person is infected with the actual COVID-19 causing SARS-CoV-2. The COVID-19 vaccines that were given an emergency use authority have already been proven to prevent severe infection, thus reducing mortality. Immunization is also needed for us to attain herd immunity, which means that even those who are not vaccinated will enjoy the same protection if 70% of the population is immunized with the COVID-19 vaccine, according to our experts. In this regard, having ourselves immunized with the COVID-19 vaccine does not only protect us, but it also protects the people around you. While our goal remains to be achieving herd immunity, we have to maximize our current vaccine supplies in the light of scarcity. We can do this by vaccinating those who are at most risk and vulnerable. Through this, population protection was implemented where there will be fewer cases of people being hospitalized or dying from COVID-19. In the context of scarcity, vaccines must be given first to those with higher risk of exposure and death. For Criterion 1, the identified priority group shall be given access nationwide before the next priority group. If the incoming vaccine supply is less than the number of people in the population group selected for vaccination, there will be further prioritization based on Criterion 2. For criterion 2, we consider the geographic location based on the COVID-19 burden of disease and the local government's readiness to effectively and efficiently deploy their vaccines. We had been implementing this in the past months through funneling majority of our vaccine supplies to the National Capital Region and other highly burdened areas. If the incoming vaccine supply is still less than the number of people in that population group selected for vaccination in that specific region, then sub-prioritization may be employed based on criterion 3. Currently, there are already 8 COVID-19 vaccines that had been granted emergency use authority by the Philippine Food and Drug Administration. This can be classified based on the platform that they are using. We have inactivated vaccines in the form of Sinovac, Covaxin from Bharat Biotech, and Sinopharm. We have mRNA-based vaccines in the form of Moderna and Pfizer, and we have viral vectored vaccines in the form of AstraZeneca, Gamaleya, and Janssen. While there are differences in the way these vaccines bring about immunity, all have already been proven to prevent severe infection, thus reducing mortality and potentially easing the strain in our healthcare system. With our vaccine priority framework and our updated COVID-19 policies, I would like to give all of you an update of our Philippine COVID-19 vaccination. As of August 17, we have inoculated over 28.6 million doses of the COVID-19 vaccines. There are now 12.8 million Filipinos who are fully vaccinated from the 5 priority sectors, namely the healthcare workers, senior citizens, individuals with comorbidities, frontline personnel in essential sectors, and our indigents. We would like to assure that the government is aggressively working to stabilize the delivery of vaccines so that more Filipinos will be vaccinated. Allow me also to give you an update on the latest vaccination issues in the country. We frequently meet with several groups of experts to guide us further to ensure that everyone that needs to be vaccinated will be vaccinated, especially now that we are experiencing a rise in cases and now that there are variants of concern and variants of interest in our country. This slide shows you the updates of our all experts group on COVID-19 vaccination. Regarding vaccination of pregnant women, they will be classified now under the priority group expanded A3. COVID-19 vaccination will be actively recommended to them if they are in the 2nd and 3rd trimester of pregnancy. They may also be allowed to be vaccinated for all of those pregnant women in their 1st trimester if they are at high risk, but they need to have a medical clearance from their primary physicians or their OBGYN. Regarding the shortening interval of vaccination doses to ensure faster vaccination for the population, our all experts group has recommended to retain the 8 to 12-week interval for AstraZeneca, wherein the doses of AstraZeneca can be given in an 8-week interval in areas with community transmission of the variants of concern. For Sinovac, they have recommended to retain the 28-day interval in between doses. Regarding booster doses, they are not yet recommending this for any group. Our vaccines still show good efficacy against severe forms of COVID-19 and death due to COVID-19, whatever variant that there may be. Regarding co-administration with other vaccines, the 14-day interval is still recommended, but we may allow in specific instances like life-saving vaccines in the form of rabies and tetanus vaccination that we can give it immediately after or co-administering with the COVID-19 vaccine. Regarding the single-dose strategy or giving all available doses of vaccines as the first dose, this is not recommended, and our experts recommended reserving the second dose until we are sure of the arrival of the succeeding doses. We have seen a rise in the pediatric COVID-19 cases, which coincides with our general rise in cases. Pediatric vaccination, however, is not yet recommended since this will affect the supply for our more at-risk priority groups like senior citizens. We have analyzed the morbidity and mortality data across all ages, and we have found that evidence points to the non-urgency of vaccinating our children at this point in time. In order to protect our children against COVID-19, we are employing the cocoon strategy, wherein the adults in priority group A at home with the children should be fully vaccinated, hence acting as an immunity cocoon to protect our children. Regarding quarantine and testing protocols that we have previously issued through the IATF, that fully vaccinated asymptomatic close contacts of COVID-19 patients may have a shortened 7-day quarantine. In the light of the rise in cases and the variants of concern, our all experts group has recommended to temporarily suspend this IATF resolution and to revert back to the 14-day quarantine among all close contacts here in the country. And finally, due to difficulties we are facing with vaccinating our dear senior citizens due to hesitancy, our all experts group has recommended the A2+1 strategy, wherein the senior citizens can bring along one household member for vaccination as long as they are a part of the priority group A. Part of the implementation of our vaccination program is continuous evaluation. Data-driven decisions are highly valued in improving our campaign for vaccine confidence. This is why the Department of Health has been regularly conducting surveys, focus group discussions, and online analytics. We also welcome independent survey findings. Based on the National Social Weather Survey, for the first and second quarter of this year, in May 2021, only 32% were willing to be vaccinated. This increased to 45% in June of 2021. The June 2021 survey also found that 7% already received their first dose of the COVID-19 vaccine and 3% already received their second dose. Here is a table from Organic Intelligence that summarizes the different polls on vaccine acceptance in the country. From Pulse Asia's February poll before the vaccine rollout, vaccine acceptance was at 16%. This increased to 43% in June. YouGov had a pre-rollout survey that showed 45% acceptance that steadily increased to 68% and 75% at the end of the second quarter or the end of the fourth month of our vaccination rollout. Despite the increasing trends in vaccine acceptance and having fully vaccinated about 11% of our population, a lot still need to be done and improved. And we learn from the experiences of other countries who have successfully implemented their vaccination program despite roadblocks. Aside from giving directives to our regional centers for health and local government partners to innovate in making vaccination efficient and accessible to the Filipino people through fast lanes, 24/7 operations, and mobile vaccination drives, we have continuously propagated health and vaccine education through our social media pages and our media partners. We had been conducting regional and sector-based town hall and kapihan meetings to address their specific needs and questions regarding vaccination and the COVID-19 response as a whole. We have been doing this with the help and expertise of our panel of expert groups. Looking at other countries and how they have dealt with vaccine hesitancy, part of the goals of the National Health System of the United Kingdom is to increase knowledge and confidence in vaccines. The aim of this goal is to improve vaccination coverage by increasing knowledge and confidence in routinely recommended vaccines. There is growing concern that the spread of mis- and disinformation, as well as a growing mistrust of science and institutions, are eroding vaccine confidence and leading to lower vaccination coverage rates. In the United States, multi-sectoral agencies have come up with strategies to address vaccine hesitancy. These agencies include the National Academics Press, the National Institutes of Health, the World Economic Forum, and the OECD organization. The World Economic Forum used the basics of marketing, saying customers, in this case patients, need to think first or be aware of the vaccines. Then they need to feel positively about it before doing it or getting vaccinated. Most policymakers have emphasized the do stage by focusing on distribution and convenience via a combination of mass vaccination, hospital vaccination, personal physicians vaccination, and drugstore sites. This makes sense for the population interested in getting vaccinated. For the vaccine procrastinators, hesitants, and rejector populations, however, we need to focus on the think and feel stages of decision making. Without these stages, patients are unlikely to move to the do stage. First, we need to increase knowledge and overcome misinformation. And then second, we need to improve on feelings. Third, facilitate action through incentivizing, making the process convenient. This action shows responsiveness, reliability, integrity, openness, and fairness. These policy dimensions can drive public trust in government institutions. A multi-sectoral approach is one of the pillars of our response. Hence, shared ownership is also important in our vaccination drive. With this, the government and the private sector has joined hands to roll out 2 vaccine information campaigns. The government campaign is called Res Bakuna, an offshoot of the Be the Solution campaign, wherein the premise that COVID-19 is the enemy and vaccine is the ally or the resback, which is associated with support or reinforcement that conveys that sense that we have a fighting chance against COVID-19 through bakuna or vaccines. To highlight the role of local governments as local leaders, the DOH provided training and playbook for local governments to use for demand generation activities. Meanwhile, the Ingat Angat Bakuna Lahat is an offshoot of the Ingat Angat Consumer Confidence campaign of the private sector. Through this campaign, online town halls are being conducted, influencers are being tapped, and discounts to more than 200 outlets were provided. Both campaigns have 3 major messages. Vaccines are safe, effective, and free. Register through your local governments and continue to practice the minimum public health standards. This will be my last slide. With the appearance of the new variants and the rise in the number of COVID-19 cases, we call on everybody to follow the enhanced public health standards. The DOH reiterates that the COVID-19 vaccination remains an additional essential strategy to complement our existing strategies of preventing, detecting, isolating, treating, and reintegrating, which are the cornerstones of our country's response to prevent further transmission. Vaccines for the longest time had been proven to be a cost-effective measure in fighting public health threats. These vaccines had been proven to prevent severe forms of COVID-19, decrease overall mortality, and decrease the strain in our healthcare system. So let us not waste the opportunity to be vaccinated once it is available. Thank you very much, and over to you, Charlene.
Thank you so much, Undersecretary. And again, thank you for sharing with us updates on the national rollout of the country's COVID-19 response program, and for highlighting that we need a whole-of-society approach with joint efforts by local and national government and various stakeholders in our response in our vaccination drive. Truly, everyone needs to be vaccinated, and that no one is safe until everyone is safe. We are truly grateful to the DOH for the partnership as we respond to this pandemic. Our next presenter is Doc Dominic Ligot. He is currently the lead data scientist of UNDP Philippines. His current work focuses on human rights, public health, food security, political risk, and fighting disinformation infodemics through the use of computational social science, social listening, remote sensing, artificial intelligence, and data engineering. Dominic founded Serolytics, a social impact data analytics company, and co-founded Data Ethics PH, an online community focused on social issues such as data privacy, data security, AI-driven discrimination, data liabilities, data ownership rights, and data poverty. Doc also co-founded the Analytics Association of the Philippines and is a Board of Trustee member of the Philippine Center for Investigative Journalism. He is here with us today to present the findings of the trends in COVID-19 vaccine acceptance in the Philippines and their implications on Health Communication Report. Welcome, Doc Ligot, and the floor is yours.
Thank you very much, and thanks to all our panelists. Looking forward to our panel discussion after my presentation. Before I share our findings, I just want to preface and also echo Dr. Vergara's points that now is the time to welcome perspectives from a wide variety of fields. The work we do at Pintig Lab actually lies at the intersection of not just health, but also data, technology, and social science. And then, as you'll see in the next few minutes, all of these fields are very relevant with the findings we need to share today. So we performed an analysis of various survey data and also combined this with social listening to come up with answers or potential perspectives to the following research questions. First, we wanted to understand what are the trends. And I think most of this will be self-evident after Dr. Vergara's presentation. But as you see later, it's apart from the trend, it's really the nuance and the context behind the trends that will be very important to discuss today. Are there any barriers and facilitating factors to getting vaccinated? I think these are quite the quintessential challenges we need to face. Not a few months ago, we thought COVID was already coming to an end. No? In February, the trends were looking very positive. But then in a few months later, we're now beset by several new variants. And at the same time, we have a new player in terms of the way things are progressing, which is vaccination. And I think the preface here is COVID-19 continues to be a very complex situation. It's not something that lends itself well to one perspective. And if there's one thing that I hope you take away from my presentation today, it's the merging of multiple perspectives on the situation that we need to bear in mind. Are there any key segments to the target population for COVID-19? I think Dr. Vergara already alluded to this. Not everyone is encouraged to get vaccinated, but there are also a big segment of the population who are. And I think that's important for us to consider, especially when we're crafting communications. How do we not just address skeptics, but also encourage those who believe in vaccines to get vaccinated? And lastly, and this is a work in progress, are there any effective strategies for communication interventions? Communication is not the only tool at our disposal, but we believe in the Pintig Lab, this is a tool that we have yet to maximize, and that's really the crux of my presentation today. So before I dive into the findings, I just want to show the range of the data that we used. So we utilized the Facebook World Symptoms Survey. So for everyone's benefit, this is actually a weekly data snapshot that comes from the University of Maryland. It's a regular survey being conducted by Facebook. It's self-disclosed. So they ask people, have you gotten vaccinated? And do you want to get vaccinated? And what are the reasons? The total sample size for the globe is around, by this time, about 250,000. And for the Philippines, it's several 100,000. And I'm happy to say that it correlates quite well with the survey findings from DOH, Pulse Asia, and NEDA. Another thing you'll notice here is that on the fifth column, you can see that the hesitancy rates across all these data sets vary quite widely. And this is something that is a reality in social science, that you'll never have a full view of the situation. And the important thing is, how do you make sense of all these potentially varied and conflicting pieces of data in order to craft a concrete intervention? So what we have done in our study is we have taken pieces of information from all these surveys and put them all together. We will use mostly the Facebook survey to get a sense of trend because it's updated more often. But in diving onto the reasons for these trends, we will utilize some of the national surveys being conducted. Let's start with the good news. The good news is vaccinations are up. So everywhere you go in the Philippines, more and more people are getting vaccinated. And this is in line with the prioritization groups by the DOH. What we want to highlight here is, although the trend generally is up, there are some lagging areas. No? So these are not all of the areas surveyed, but you'll notice, obviously, NCR is ahead of everyone else. But there are some areas, for example, Western and Eastern Visayas, that are falling back. And I think that's something worth diving into when we try to understand the factors for this. More good news is, in terms of hesitancy, generally the trend is down, and that's also good. This is also evident in other fields. The more people patronize a particular product, the more other people will be more disposed to patronize it. And if you can consider vaccination as a product that we'd like to market, generally people are following the same trend. Now, this is where what I was saying about nuance comes in, because if we combine the two data sets, this is what it looks like. Although generally the relationship is negative. So the more people who get vaccinated, the less people are hesitant. We're not saying what causes what. I think it's really the sectors or the clusters and the nuances that matter. For example, on the lower left are people who, despite exhibiting lower levels of hesitancy, are not quite up there in terms of vaccinations. And then on the other hand, the upper right quadrant, you have areas where, despite a higher level of hesitancy compared to the norm, they're also getting vaccinated. So it's not necessarily a one size fits all compared to like upper left and lower right. And this is where the study that UNDP Pintig Lab chose to focus on. What accounts for all these differences? And maybe these differences are, a venue for us to craft interventions. So we looked to the MINDA, DOH, and Pulse Asia survey for this. In these surveys, they ask people if they had vaccines available, would they be willing to get vaccinated? And if so, or if not, what are the reasons? And this is a summary. I'll just highlight a few areas for ease of interpretation. So here in the upper left box, these are the top reasons people have stated the reason why they want to get vaccinated. And then here on the lower right are the top reasons for people who said they were either not sure or not likely to get vaccinated. What are those reasons? And I think this is very important for us to zoom in on, because if we look at everyone in the Philippines, it would be easy, it would have been easy if everyone thought the same way. But what we're finding from the DOH data is that there are actually very distinct segments, and not all of these reasons are present in each segment. So in our study, we found there is at least 7 segments in the population. I won't get into too much of the detail here. I encourage everyone to have a look at our report. But simply speaking, the first 4 segments in blue, these are the easy segments. They're the ones who already believe in the vaccines. They're the ones who are just waiting for availability or supply to come into their area, and they will be the first to line up. So the easy cells are the most convinced, they only have 1% hesitancy, all the way down to what we're calling the pragmatic segment. So they are willing to get vaccinated, but they're also concerned about lack of supply and perhaps a tedious vaccination process. And this speaks to, vaccination is not easy to roll out nationwide, and there will be areas where vaccination is harder than most. But it's good to see that even on a survey, we're able to pick this up. On the latter 3 are segments that are less willing to get vaccinated. So you have the complacent and the obligated segments. Generally, they will get vaccinated, but they will not be the first to line up. Particularly the obligated segment. These are people who said, okay, if my work demands it or if my travel demands it, I will get vaccinated. But it's also interesting to see the reasons they are probably not willing to get vaccinated, which aren't present in the first 4. Some segments, such as the complacent segment, don't even believe COVID is a risk. This is interesting from a literacy standpoint. Despite all of the overwhelming evidence of how dangerous COVID is, there are people who still don't believe that literature. There's also people who do not trust experts. And this talks to Dr. Vergara's statement earlier that despite our best efforts, there's still an undercurrent of anti-science and anti-expert sentiment. And we need to think about how to reach them. And lastly, you obviously have the skeptical ones who have no reason to get vaccinated and they believe all of the negatives, and they're probably the last, if ever, to line up. The last thing I want to highlight here is as far as in terms of media use, not everyone is on social media. And that's, I think, something to think about. Since the pandemic started, everyone has gotten used to working from home and having these video conferences and using social media as our main source of news. But what we're seeing from the survey results is there are segments of the population, especially the more hesitant ones, who are not reading social media. They're more driven by the traditional media like TV. And that means that a multi-platform strategy still needs to be in place. We cannot be doing everything on Facebook, Twitter, and TikTok. So how do we try to convert this insight into some form of intervention? And this is where we look towards communication science and technology adoption. So this is known as the diffusion of innovation curve. It's actually a well-established behavioral pattern. Anytime you have something new to adopt, for example, cellular phones, the internet, anything new that you want to introduce to a population, there will always be these 5 segments. The innovators and the early adopters are usually the ones who already believe the technology from the beginning. But to get to early majority, you need to cross what is known as the CHASM. And that's where this webinar gets its name. And the reason for this is you won't get mass acceptance of an idea or a product until you hit early majority. And once you hit early majority, then you have this herd mentality. Maybe everyone will start jumping on that bandwagon. So what is the CHASM? The CHASM states that early adopters and innovators will be easier to capture because they already believe in your product. Some of them may have actually invented or driven that product, so you have no questions asked from them. But the moment you start crossing into early majority, you now have to start to address a growing reasons or concerns related to hesitancy. And I think this is where we need to focus on. Incidentally, the literature also shows that the CHASM normally occurs around 13.5% to 15%. And I think based on the latest statistics, we're just about at that level already in terms of vaccination. We have about 12 million fully vaccinated. So we're about to cross that CHASM, if not there already. If we overlay the 7 segments, it aligns quite nicely. So even though you have the first 4 segments who are generally willing, early majority states that we need to now address those subtle issues that the supporters and the pragmatists are looking at. And a lot of that can be operational. A lot of that is communication driven before we even get to the latter 3. We also attempted to look at the regional distribution. It also lines up quite nicely. But again, I don't want to oversimplify the issue. There's the presence of all these other segments within these regions. And I think that I want to underscore that even though we're looking at regional behavior, we need to dive deeper into each region and see how the distribution of these segments are in order to be more effective with communication. So that brings us to, I guess, the main crux of this presentation. COVID-19 is a health crisis, but it is also a social science problem because we're not just dealing with the progression of a virus, we're dealing with the progression of behavior. And that is driven not just by biology, it's driven by ideas. The WHO and the DOH use a framework called the BESD, or the Behavioral and Social Drivers for Vaccination. And this is actually a very practical framework because it looks at all of the factors that drive your intended behavior, which is vaccination. But in social science, we also know that the only thing you can really influence here are the practical issues. In other words, informing people where vaccine is available, making it easy for them to access, making it making it a preferred site, basically the logistical things. These are the easiest to influence. All of these other factors here, like motivation, what they think and feel, and social processes, are really very hard to change. They're almost a given. And this is why, apart from informing people how things, how they should behave, we have to also address the reasons why they choose to behave one way or another. And that's how this framework can work. And this is where we come back to, our recommendation. The research actually points to targeted communications, and we can align these communications with the reasons that we have derived from the surveys. We are recommending at least 12 types of campaigns. These are not set in stone, but the idea we want to address here is we need to be addressing more than just the informative approach. We have to look at, as Dr. Vergara said, the thinking and the feeling, and then that leads to the doing. There's at least 3 types of emphasis here. The first is cognitive. This is addressing reasons that are more philosophical and more cerebral. You want to discuss, why is it important for you to get vaccinated? Or I think the bugbear in everyone's minds, this whole issue on side effects, just how significant is that? And how do you deal with the misinformation related to that? It will not convince everyone, but there is a sizable segment, particularly the obligated segment, who are usually highly educated, ironically. They're, masters, PhD people. They love to pour into medical journals and vaccine statistics. And they come up with reasons that people should not get vaccinated. So I think that's an important segment to address. There is evidence, overwhelming evidence, that vaccines help, and we need to be able to drive that message. The second approach is more about managing fears. This is not fear-based messaging. This is about addressing people's fears. And the underlying principle here is, number one, we have to convince people that there is a threat. COVID is still there and it's still growing. But at the same time, give them the empowerment that if you want to control the threat, vaccinations are the answer. I think what you'll see in many communications outside of DOH is it's often just one-sided. People are either just talking about the threat or talking about the cure, but often this falls flat because if you just convince people that there is a threat, they get fearful. And if you just talk about the cure and people are not convinced that there is a threat, then they won't take action. So fear management is about balancing those two messages. And lastly, and I think this appeals a lot to the Filipino, we have to show stories of people who have already done it. You know, we don't show this enough. We need to illustrate stories of people who have gotten vaccinated. And the good news is people are actually doing this on their own already, especially on social media. People are taking photos of themselves getting the jab. People who are saying, I didn't get any side effects. I think this deserves added attention because on the opposite side of the fence, you have people who are showing the opposite. People who are saying, hey, I got rashes or I got palpitations. And that also, creates kind of a negative sentiment. So we can use that underlying behavioral pattern. If we show more and more people getting vaccinated and basically surviving vaccination, it helps drive that behavior. So again, these are starter ideas. The point here is to do a multidimensional type of communication strategy. And in each region, it might be a varied combination of the 12. Another thing that we'd like to highlight, and we've been talking, with the DOH Health Promotion Bureau, is that digital data provides a lot of opportunity, to understand the ongoing challenges. And this framework is being used by HPB. They utilize a lot of insights and recommendations coming from social media and surveys, and they use this to guide policy and deployment, demand generation, and tactical communications. This is very important for us to reinforce. But at the same time, from talking on behalf of the UNDP and the Pintig Lab, there's a lot of opportunity we can bring to the table when we utilize kind of the wide variety of data that we have in social media. Right now, we're merely looking at demographic and psychographic data, and to a certain extent, geographic data. There's a wealth of information when we start mining opinions from social media. What are the trending keywords? Doing some network analysis on, Filipinos are by nature very cliquish offline. We are also cliquish online, and understanding who are the key opinion leaders and maybe enlisting some of them to help us. DOH already enlists the help of influencers. But at the same time, this has to be combined with community management on the ground. We also have social networks that are not online, and that's the opportunity. So I think I'm just about out of time. I want to, just recall, one of my early inspirations in my own careers, Professor Hans Rosling, the late Hans Rosling from Sweden. He's a professor of health. And he was one of the first in the health sector to say that data is often better than you think. I mean, we don't have perfect data, but data is there. And if we take advantage of it, you could yield other strategies and insights. And this is the time when multiple disciplines should be collaborating. It's not, as I said, it's not just a health crisis. It's a behavioral crisis. It's a social science crisis. And all this data can be used to various ends. So some recommendations in our report. First, let's acknowledge and congratulate the DOH for the positive trend in vaccinations. This did not happen in a vacuum, and it continues to improve. But at the same time, we still have those who are unwilling and undecided. Second, this is now the time, quoting the diffusion of innovation, where it will get a little harder to encourage acceptance if we don't understand the nuances between populations. So a one-size-fits-all strategy simplistically won't work. But at the same time, do we understand the drivers to make sure that the targeting is effective? Third, the BESD framework helps us with messaging cues that address all sorts of issues, whether it's fear, whether it's cognitive issues. And we need to drive that message further and then measure it using social and digital tools. Finally, of course, subject to logistical constraints, we also need to understand, are our communications working? And we need to also look at the enemy on the table. There are also people pushing anti-vax communications, and we should study how they're doing it and understand what they might be doing better than us and take advantage of some behavioral patterns they're using. And lastly, again, Pintig Lab is a data lab. UNDP invested heavily in this, and we're more than happy to provide that support to DOH, the HPB, and other collaborators. I think data is, indispensable, but we also need to filter the data. Everyone keeps saying data is the new oil. I also say data could also be the new pollution if we're not careful. So thank you very much. Hope that helps elicit a lot of good conversation, and looking forward to the insights from the panel today.
Thank you so much, Dr. Ligot. The trends in COVID-19 vaccine acceptance in the Philippines and their implications on health communication report will be made publicly available today, along with the presentations as well. We will include them in the post-event newsletter that we will be circulating. For those who might have any questions on the presentations given by Dr. Vergara and Dr. Ligot, please feel free to put them down in the Q&A box here on Zoom and on the comment section of our live stream on the UNDP Philippines' Facebook page. Now we have come to the portion of our program that's most exciting, perhaps, to help us further unpack the key insights and to discuss how we can influence vaccine acceptance at the local level. We have invited esteemed speakers from across different sectors for a panel discussion, which will be moderated by no other than Dr. Nina Castillo-Caranda. Her career as a sociologist in the University of the Philippines began in the Agricultural Sciences campus in Los Baños before she joined the Health Sciences campus in Manila and went into the fields of health, social science, clinical epidemiology, and global health. She has looked into sociocultural dimensions of health and healthcare, the perceptions of laypersons, patients, healthcare providers, policymakers, and how such can affect health-seeking behavior, clinical practice, as well as policy. Her current work looks at different facets of the quality of life and the Filipinos' search for kagalingan, or well-being, happiness, and health, and living well and being well. Dr. Nina is a member of the World Health Organization's Social Science Working Group of COVID-19. She was also appointed in December 2020 as a member of the National Technical Advisor Group, or NETAG, for COVID-19 vaccine. We are truly grateful to have her as our moderator for our panel this afternoon. Welcome, Dr. Castillo-Caranda.
Thank you very much, Ms. Charlene, for the generous introduction. Good afternoon to everybody. It's an honor for me to be invited to moderate this afternoon's discussion. Thank you to UNDP. Thank you also to NEDA, to the Department of Health, to the Analytics Association of the Philippines. Thank you, Yusek Rosette, although she's already left for another meeting, for the updates and the ways forward. I always learn something new, even if I practically listen to her every day for different updates and meetings. Thank you also, Dr. Ligot, for citing the work of sociologist Everett Rogers. I'm a sociologist by training. His theory of the diffusion of innovations was still in the 1960s. And as you can see, it's a classic sociological theory. And thank you also for exploring the messaging cues with us. There's indeed a lot of work to be done. I look forward to discussions this afternoon with Assistant Secretary Carlos Bernardo Abad Santos, with Dr. Alfonso Miguel Regala, with Governor Dax Kua, with Dr. Ronald Mutasa, and Mr. Urbina. Turn it back to you, Charlene, to introduce the panel again.
Thank you so much, Dr. Nina. And as I've mentioned, we are fortunate to have these 5 panelists from various agencies and sectors to share with us their perspectives and insights as well. Please allow me to introduce them to you one by one. Our first panelist is presently the Assistant Secretary for Policy and Planning of the National Economic and Development Authority of the Philippines. Assistant Secretary Carlos Abad Santos was previously the Director of Governance Staff under the same office. As Assistant Secretary, he has oversight and supervision on planning and policy formulation of the sector staffs for governance, macroeconomy, social development, and trade, services, and industry. Let us all give a warm welcome to Assistant Secretary Carlos Abad Santos.
Good afternoon.
Good afternoon, sir. Our second panelist is Dr. Alfonso Fonsi Regala, who currently leads the Program Implementation and Outreach Division under the Health Promotions Bureau. He previously served 4 years in Northern Samar and was Chief of Hospital at Dr. Gregorio B. Tan Memorial Hospital. Dr. Regala holds an MD and MBA from Ateneo School of Medicine and Public Health and is part of the inaugural cohort of the Obama Foundation's Leaders for Asia Pacific in 2019. Welcome, Dr. Regala.
Good afternoon.
Good afternoon. Our third panelist is Governor Daquila Carlo Daxcua, who is the newly elected governor of Quirino Province. Having served 9 years as congressman, 6 years as vice governor, and 3 years as governor, he has broad experience in the executive and legislative branches of government. Due to his exemplary contributions, he received various awards and achievements, which includes Gawad KKK Outstanding Youth of the Philippines Award and Most Outstanding Vice Governor of the Philippines, among others. Recently, he was elected as the National President of the Union of Local Authorities of the Philippines, or ULAP, and the National Chairman for League of Provinces of the Philippines, and the umbrella organizations of all of the leagues of local government units and elected local officials in the country. Good afternoon, Governor, and welcome.
Good afternoon.
Our next panelist is Dr. Ronald Mutasa, the World Bank's practice leader for human development for the East Asia and Pacific region. He has more than 2 decades of global health experience, including several years of leading World Bank flagship lending programs in health systems strengthening and reform in South Asia, East Asia, and the Pacific. Thank you for joining us, Mr. Mutasa.
Good afternoon. Thank you.
Good afternoon. And our last panelist for this afternoon is Mr. June Ryan Urbina, the Communications Officer for Vaccine Preventable Diseases and Immunization at the World Health Organization Philippines Country Office. He leads communication and social mobilization initiatives for routine immunization and vaccination campaigns, including the COVID-19 vaccine rollout. He also supports the COVID-19 risk communication and community engagement activities at WHO Philippines. So I'll give a warm welcome to Mr. Urbina as well.
Good afternoon.
Good afternoon, sir. Before I turn it over to Dr. Castillo Carandang for the proper of the panel discussion, I would like to again remind our audience to use the Zoom Q&A section to submit your questions to the panelists. We will all have an opportunity to ask them during our Q&A portion, which will take place after the panel discussion. Thank you so much, everyone. And the floor is yours, Dr. Nina.
Thank you, Ms. Balaan. I'd like to start our conversation this afternoon with the distinguished panel with an opening statement. And some of you might actually find it provocative, but I've not known to be anything less. For me, context matters. I'm a sociologist, and as you know, in social science, context always matters. We are already on day 523 of whatever lockdown restrictions there are. I cannot even remember what M means, E, what are the different restrictions. And these are the letters of the alphabet I wish to never hear of again. M, E, C, Q, and then with heightened restrictions. So people are hungry. Many have lost their income. The education of our future generations of Filipinos has taken a tremendous setback, despite what DepEd says. People are struggling to cope, and mental health problems are on the rise. Our healthcare workers are tired and they're frustrated, and they're not adequately paid for all of the risks that they take on for us. We not only have a pandemic, we're also suffering from an infodemic, which was already mentioned by our 2 previous speakers. More cases and deaths due to COVID-19 are seen daily, as Yusek Rosetta has also shown. Many hospitals are full. Testing, tracing, treatment efforts, as well as a seamless vaccination system are still highly inadequate. Hence the need for additional protection offered by the COVID-19 vaccines. Yusek Rosette has already shared the update that over 29 million doses have been administered, but that is only about 11% of the target population. So we're still far from where we want to go. The social weather stations released a survey done in June, and it shows that the access to a COVID-19 vaccine site is not as good for everybody. So 68% of adult Filipinos have easy access to COVID-19 vaccination sites. And this is true for Metro Manila and among the more educated groups. 3% have difficult access. 29% have no access at all to the vaccination sites. So we're not just talking here about vaccine confidence, vaccine hesitancy. We're talking here about absolute access. So we're targeting about 50% fully vaccinated people in NCR, but yet we haven't been able to reach that yet due to the lockdowns. So the data, especially from the Philippine General Hospital, where my colleagues and I work together, are an estimated 8 out of 10 patients admitted for COVID-19 in 23 hospitals in Metro Manila are unvaccinated or only partially vaccinated. So that is where our context lies. And that is where the challenge is even greater. And it's not just an issue of vaccine hesitancy or vaccine confidence, it's issue of access. So that's my opening statement. I hope that started you already thinking, my fellow panelists, of how our conversation will go. So this is for all of the esteemed panelists. What are your key takeaways from the two presentations of Yusek Rosette and also from Dr. Ligot? Can I start with NEDA Assistant Secretary Abad Santos, please?
Yes, good afternoon, and thank you, Dr. Nina, for that very provocative, opening statement. And I guess I think from the two presentations that are very, very insightful. On the overview of the COVID-19 vaccination in the Philippines, I think the main takeaway there is that I think it's basically also your point. Access is very important. And I think what Dr. Vergara said is that looking at the differences between, let's say, the SWS surveys from May to June, just that 1 month that we were able to ramp up vaccination, that decreased the hesitancy in vaccination. We saw that. So again, I think very important is that we need that access, because again, that access is also a key to a lot of the acceptance. Again, we still have population segments that will have that hesitancy, but again, access is very important, and because that will drive acceptance, and that's actually a big driver of acceptance. In terms of the trends, the second presentation, I think very, very important is that, again, while science-driven and risk communication have been developed in promoting vaccine uptake, which was shown and very, very helpful, I think the LGUs should recognize the different forms of communication or approach, that these different forms have varied effects on groups of individuals with different vaccine behaviors. So I think it's very important that we have these different distinct population segments, and then which is very important and very insightful, because again, these population segments can determine our approach to our risk communication.
Thank you, Assistant Secretary Abad Santos. I was informed by our host that Governor Dax will have to leave very soon. So I'll ask him for his insights also from the two presentations, and I hope the other panelists don't mind if I also ask Governor Dax already for the other sets of questions. Okay. Governor Dax, what are your key takeaways po from the two presentations?
First, thank you, Dr. Nina, and thank you for inviting ULAP to be part of this important undertaking and research and discussion. To Yusek Rosette and Professor or Dr. Ligot, thank you for your insights and your presentation. Ang dami kong natutunan today. I learned a lot, and I think it's very timely, and the discussion is very relevant. Professor Nina, Dr. Nina, I will try to stay as long as I can, but there's an ongoing IATF.
Yes, I know. Our fate for the virus quarantines are going to be decided this afternoon. So the letters of the alphabet, Governor, which I don't want to hear about again. Go ahead, po.
Yeah, so, okay, so let me try to share with you our experience and our takeaway from the presentation. So the the presentations earlier were very, very interesting, especially I've already, just like you, Dr. Nina, I've already listened to this presentation of Dr. Rosette, and I'm always constantly updated about the situation there and the recommendations of DOH. What was more interesting to me this afternoon was the one from Professor Ligot and how social science affects this whole process that we're trying to go through. Totoo po, no? What we're trying to go through is unprecedented, at least in our lifetime. And what government is trying to do as well is unprecedented. I don't know if there's ever been a vaccination drive this massive. I don't know if there's ever been a international or national effort against an epidemic or pandemic at this level of concentration involving provinces, municipalities, cities, all the way to barangay officials and BHERTs. No? So talagang unprecedented ito. And I'd just like to say that you're right. Access is very important, which is why earlier this morning when we had a meeting, yung governors po had a meeting with the DOH, with USEC Reset as well, we were asking about vaccine distribution. Paano nga ba na-allocate yung bakuna? How much goes to the provinces? How much is it a percentage of population? Is it how many we've listed in our alpha list? Ano nga bang masusunod? So that we get our fair share and we roll out in the different provinces of the nation. Another discussion we had was, bakit sa NCR plus 8 pwede yung A4? Bakit outside NCR plus 8 hindi pa pwede ang A4? We don't understand that. No, those are things that need to be reviewed. We believe that need to be assessed so that we can all have an equal or equitable way of distributing the vaccines and administering them to frontline economic workers, not just the frontline health workers. So those are things that we are discussing, and hopefully DOH has mentioned naman, it is shifting towards a more equitable distribution of vaccines already. Now, maganda yung sinabi mo, Dr. Nina, about access to site. So yan ang talagang trabaho namin sa lokal. How do we now bring these vaccines dun sa mga isla? Kasi Metro Manila is not the entire Philippines. So, ang dami nating isla, 7,000 islands. How do we now bring these vaccines dun sa mga taga-isla? Dun sa mga nakatira sa taas ng bundok kung saan walang kalsada? Yun yung mga kailangan na sagutin ng LGU with the help of the barangays, the municipalities, and the provinces as well. So there's been many ways. Pwede kami mag-house to house. It's now not only a social science problem. It's not only a health problem. It becomes a logistics and transport problem that we need to solve so that we can bring the vaccines to the people or the people to the vaccine. Those are my key takeaways as of now. And gusto ko lang itanong sa iyo, Dr. Nina, you mentioned 8 out of 10 ba? Tama ba yung number ko? 8 out of 10.
Yes.
Unvaccinated that are hospitalized.
Unvaccinated po or partially vaccinated among the 23 Metro Manila hospitals. And this is also a reflection of our data po from the Philippine General Hospital. As you know, PGH is a national referral center for COVID. So we've been receiving a lot of patients who are partially vaccinated or unvaccinated, but that also has to be cautioned, interpreted with caution, because probably they don't have access yet to the vaccine. So that's possible too. And my assumption is that it's actually a reflection of the amount of vaccination that we've been able to do. And USEC Reset confirmed it, that only about 11% of our target population have indeed been vaccinated. Thank you, Governor Dax.
Thank you.
Can we proceed to the questions which I have reserved for you so that I am sure that you can contribute before you go? So thank you. You mentioned very important issues there. As you probably know, we've met before in other webinars I've done for ULAP. I'm an advocate for vaccine equity. And again, what's the formula for dividing the vaccines? I have heard actually some governors in their different meetings talk about, we're also Filipinos. Why aren't we be given our dose of the vaccine? I've heard mayors and governors talk about that. So as you know, LGUs like yours are directly responsible to responding to the challenges of the pandemic in the barangay level, municipal, city, and provincial level. Given the varying levels of response, how do you think can LGUs, with the support of ULAP as your mother organization, further promote vaccine acceptance at all levels, barangay, municipality, cities, and provinces? What strategic approaches and targeted campaigns can be done? Ano pa ho ang kulang natin? Hindi ko na ho maisip kung ano pang gagawin natin. So any insights on that, Governor Dax?
Thank you, Dr. Nina. First, I'd like to say na tama kayo na importante yung campaign. But the way I see it now, as presented by our experts earlier then, parang the trend is in our favor. So hesitancy has been going down and acceptance has been going up. But we're not yet done. We still need to convince all, if not most of our population. No? So hindi pa tayo tapos. But ang nakita ko in my own personal experience, ang nakita ko pinaka-effective are local leaders telling their stories, how it was for them to decide, how they went through their process of decision making about whether they were going to be vaccinated or not. Hindi pwedeng sabi ni doktor, sabi lang ni ganyan. Kailangan i-share ng local leader, whether it's a barangay captain, barangay kagawad, mayor, konsehal, or a governor, telling the people, ako, ganito inisip ko ganito ang process ko. This is what made me decide that I should be vaccinated. My wife should be vaccinated. My parents should be vaccinated. My lola should be vaccinated. That has the best, I think, acceptance to the people you're talking to because it's sincere. It went through your process. And then you just tell them na at the end of the day, if you're still not sure, you ask an expert. Don't ask in Facebook. Don't ask kung sino lang. You ask a doctor who will guide you properly. That's my experience. That's why it's important dito sa aming probinsya, at least my experience was whenever we get a batch of vaccines in Quirino, I ask the mayors and the doctors, the health officers to report to me how many vaccines were given to each barangay. I want each barangay to receive their fair share of vaccines so that somebody there can start telling them about how they went through that decision and their experience. And I think that makes the hesitancy problem a little bit more manageable.
Okay, that's a very valuable insight. Storytelling. Mahilig po ang Pilipino sa storya. At kwentong kutsero at kwentong totoo. No? So I think that's a very valuable insight that, again, if we want our constituents to actually be vaccinated, we as leaders should also be the ones to share the stories also. Thank you, Governor. Any other things which ULAP is planning, which we haven't talked about? Any other initiatives that you are exploring? In preparation for this webinar, Governor, I actually looked at your Facebook page of Quirino Province. I looked at it, studied it, and I saw that for the indigenous Filipino groups that we have, you transported them to the provincial gymnasium, if I'm correct. So what other kinds of out-of-the-box strategies are you thinking, such as that?
Yeah, well, for Quirino and well, for ULAP, our main focus right now is really to, what I mentioned earlier, to fight for equitable distribution. Although we respect and we understand the strategy in the past couple of months to contain the surge in Metro Manila. They had to concentrate a significant portion of the vaccines in Metro Manila para mag-contain yung surge. But henceforth, from now on, sabi ng DOH, dapat mas equitable na talaga ang distribution dahil medyo contained na ang Metro Manila. And that's where we're jumping off to. yung sinasabi ko kanina doon sa equitable distribution, what we are both fighting for, Dr. Nina, I think is very essential. Kasi in the national level, it gives confidence to the leaders, to the governors, to the mayors, to be able to tell their people na meron tayong fair share of vaccines. Hindi kayo mawawalan. Pero kung dadating sa kanilang munisipyo, 500 vaccines lang in 2 months. Napaka-konti Ang hirap nun for a mayor to keep fighting the campaign of communication when the ammunition is not there. So kailangan talaga kasabay ng bakuna yung campaign natin on communication. That's also the reason why in our LGU, we make it a point that each barangay, each locality, each demographic, each type of indigenous people has a fair share. Kasi nga, that ensures that everybody in every corner, in every demographic, can be able to say na, nabakunahan ako. Okay naman experience ko, nilagnat ako ng konti, pero nakaraos din naman. O yung tatay ko, nabakunahan, nagka-COVID siya, pero nagamot, hindi na siya kinailangan ma-hospital. So those are the things that that we have been doing, which I think will be key for us to be successful at rolling out the vaccination. But Dr. Nina, I think one innovation I would like to make because of what you said, I would like to use what you said na 8 out of 10 na hospital ay yung mga unvaccinated or partially vaccinated. That I think is a very strong line to convince people to get vaccinated.
Thank you po, Governor Dax. Can we go now to the other panelists too? Dr. Pons, gandang hapon. Can you tell me your key takeaways from the 2 presentations?
Yeah, Prof. Nina, I guess first one is that our assumptions change. No? So there were previous assumptions that areas with high COVID burden would have higher risk perception. And then those areas with higher risk perception would necessarily translate to higher vaccine uptake. But what Dr. Ligot showed is it nuanced those 2 assumptions. So areas with high COVID burden may still have low risk perception. And in areas with high risk perception, they can still have low vaccine uptake. So I think one of the important insights is that the presentation showed different vaccination positions occur, and these also occur across and within priority groups. And it's important that we nuance these so that we know how we can unify our messages at the national level and still be able to contextualize them at the local level. The second insight that was striking for me was how hesitancy, vaccine coverage, and COVID burden were all linked together. It would be interesting to see how the trends over time has changed for the 2 diagrams. And currently what the department is working on, you also mentioned access. No? So we are looking into adding maybe another layer. How can we incorporate feedback on the vaccination process? One of which includes access. There are several other steps. And incorporating that will allow us to complement our demand issues with our supply and other operation issues. That could hopefully provide better insight for our messages and interventions moving forward.
Thank you, Dr. Pons. Again, there's no one size fits all. Okay, that's what you're sharing. And that over the course of time, I mean, I started working intensely with DOH in December. Our conversations were different in December versus yesterday. Okay, my talk yesterday for DOH was on good information hygiene. So the concerns have also evolved and the different issues are really still unfolding as we speak. Okay. Thank you, Dr. Pons. Can I now go to Dr. Mutasa?
Thank you.
Good afternoon, Dr. Mutasa. For you,
Yes.
sir, what are your key takeaways from the 2 presentations?
Thank you so much. So I'll begin by thanking the UNDP for organizing this very important and timely dialogue. The first part that I just want really to acknowledge is the fact that both presentations actually highlighted the fact that a successful vaccination program depends not only on supply, but it also goes to the behavioral determinants and also the social determinants, which actually are more important in terms of the uptake of the vaccine. So it was really nice and heartening to hear Yusek Vergara and Dr. Ligot really focus on the think and feel stage of decision-making. So I think that was really, really important to see that the DOH, as well as our colleagues at the UNDP are paying attention to this. Just a few quick points to highlight from my end. Number one is that the results presented by Professor Ligot are very consistent with some of the data that we have been tracking through our own internal surveys within the World Bank over the past 18 months, but on vaccine hesitance within the Philippines. And it's actually also quite interesting, I think, listening to the presentation that there is a lot of work that needs to be done, particularly focusing on women and individuals without college education. And also, a second aspect is that it is high time basically to shift away from generalized health promotion or literacy interventions to much more targeted messaging. And in the Philippines, I think what matters even more is basically targeted messaging by region, driven by data to respond to the key barriers that are impacting people's acceptance to get vaccinated. So let's move away from mass media campaigns, mass electronic campaigns, but sort of like to much more targeted messaging and focus on the key issues across the different regions based on the slides and evidence that Professor Ligot shared with us. The third part is basically the fact that who delivers the message on vaccine acceptance matters. And we saw from the data that there is greater trust in doctors and health professionals, and there are lower levels of trust in politicians. So I think as we go forward, it is really important also to ensure that doctors, health professionals, family members, and other sources of information who are more trusted actually get to disseminate information on vaccine acceptance more and more. Then basically my last point, which I want to highlight as a takeaway and also as an addition to this these two very good presentations, is the fact that within the World Bank, we've actually conducted an experimental study within the Philippines of around 1,800 Filipinos who are yet to be vaccinated. And one of the key things that came up from the 4 different arms of the study was basically the fact that social benefits to getting vaccinated are highly valued and they highly matter to the population. So it is important that as we go forward, we really need to think through interventions that are designed to make individuals within the Philippines reflect on some of the events within their lives that are key and that they're looking forward to being able to get to do again after being vaccinated. Because it is those things that people look forward to doing again after being vaccinated that, according to the evidence, that really tends to matter. So I think I just wanted to add this, that let's also look at the social benefits of getting vaccinated as one of the key areas for health promotion, behavior change, communication, so that this message is really carried across very clearly. We know, for example, that Filipinos are very big on Christmas. Can we basically use a message basically to highlight that if we all get vaccinated, perhaps this could actually be one opportunity for us to celebrate Christmas together again with our families and our loved ones. So let me stop here and just to say thank you for these very eye-opening presentations to Yusek Vergara and to Professor Ligot, and also just to highlight that we're very keen to contribute to this, to working together to build even more evidence. Because as you rightly said, Dr. Nina, context matters. And for vaccination, it's context plus behavior, which really matters. So thank you so much, and back to you.
Thank you, Dr. Murtasa. Before we proceed, we just like to thank Governor Dax Kua formally before he leaves. He needs now to join the very important meeting of IATF. Salamat po, Gov. Nandiyan ka pa ba?
Good, Dr. Nina.
Magkikita na lang po tayo uli.
Yeah, thank you again. And to my co-panelists, thank you as well. Congratulations.
Thank you po. Okay. So thank you, Dr. Mutasa, for again highlighting the social determinants of health, okay, because it isn't just all vaccine supply. It isn't all just also an access issue, but where we are determines also what we look at and how we actually look for the different things. So targeted messaging and the incentives. People are hungry, as I started off the statement. People are without jobs. So what actually matters to them is what to feed my family today in the middle of the lockdown. So again, some LGUs I know have also resorted to distributing, for example, different food products, food items for people who line up in the vaccination site. So there's 1 or 2 kilos of rice if you complete your vaccination and so on. So all of these behavioral incentives, while small, are also very symbolic and might also give a positive message. Thank you. Let me now go to June Urbina. June, what are your key takeaways from the two presentations?
Yes, thank you very much, Doc Nina. I agree with what most of the panelists have mentioned, that we need to take a look first at supply and the access issues before we discuss further on hesitancy. And this is very consistent with the WHO Strategic Advisory Group on Immunization, Strategic Advisory Group of Experts definition of vaccine hesitancy, which is the acceptance, delay in acceptance or refusal of vaccines despite availability of vaccine services. So where in cases wherein there's unavailability of vaccine services or problems with supply, these need to be addressed first. Then we can address vaccine hesitancy. Taking a look at both the presentations, I think this reminds me of the learning curve that we had to go through as well in the more recent vaccination campaigns we had, like in the 2019 measles campaign, the 2019 to 2021 polio campaign, and also the recent measles rubella campaign, where the country had to go through a learning curve, wherein at first there's a struggle of accepting the vaccines, and then we reach a certain point where there's a vast majority accepting the vaccines. But the real challenge for the health sector really is what we call as the last mile vaccination. And this is getting into a bit more context, as you've mentioned, looking at the areas where there's high hesitancy and understanding exactly what those audiences are. And the tool and the process being used or presented by the UNDP earlier is very useful in this aspect, in last mile vaccination, for us to recognize what are the determinants of those groups which have low uptake. And in the implementation side, what this tells us is we would need to capacitate further at the local level the use of social data, such that our communicators, our vaccination programs can better design interventions depending on the exact needs of the audience. And in terms of messaging, what would be the exact messages which would cater to their own needs. And I think this is a capacity which we have been learning as we've been going through the different vaccination rollouts, and hopefully we can optimize this further in the COVID-19 vaccine campaign.
Thank you, June. June brings a wealth of experience from past vaccination campaigns also, not only for COVID-19. Actually, June, this lunchtime, I was asking my husband, it's so hard to actually convince adults to be vaccinated, because in general, it's only babies who are vaccinated. So that's also a challenge, as you know from your own work with the World Health Organization. And it's a learned behavior. Vaccination is a learned behavior. Can I put everybody on the spot? How many of you have received other vaccinations aside from COVID-19? Can I see the panelists? Flu, pneumococcal, okay. So it seems like we're pretty good hands. And how many of you have already been vaccinated for COVID-19? Okay. I've also been vaccinated, and it's funny. I live in a household of 3, and my husband got a Chinese vaccine. I got a British vaccine, And our daughter, who's an incoming clerk in the Philippine General Hospital, got a Russian vaccine. So a family of 3 sourced the vaccine from different sources and ended up with 3. So I always kid my colleagues that probably we could do a clinical trial as to what is the effect of immunity for the 3 kinds of vaccines we received in our family. And I'm sure it's the same also for other families too, that whatever is there, they have tried to optimize their opportunities to access the vaccine. Thank you, everybody, for your key takeaways from the 2 presentations. So can I now go to the specific questions? For ASEC Abad Santos, what do you think are the key insights or recommendations from the UNDP study which you think would be most useful to the work that NEDA does, particularly with regard to COVID-19 strategic communication within the interagency task force? So I know that NEDA is a key partner. And what do you think are the insights or the recommendations from the UNDP study which would be most useful in NEDA's role for COVID-19? Thank you, Ase.
Yes. Again, I'd like to premise this that again we on our work in NEDA. Like last year, we released the We Recover as One report as chair, NEDA as chair of the IATF-TWG on anticipatory and forward planning. And again, what we highlighted in that report in terms of addressing COVID-19 and facing up to the challenges of the new normal is that we need to convey the right information to the public to gain trust and confidence. So I think that's very important. I think that the communication that we put out for COVID, whether specific for vaccine or any aspect of the management of pandemic should be the right information, should be timely information, because we need to gain public trust and confidence, because it's very, very important. We have always been, it's part of our work to be an advocate of evidence-based policy making. And again, this study is very important in terms of, again, providing the advice to both the IATF and the National Task Force against COVID-19. I just want to digress that, again, for policymakers or policy researchers, again, this pandemic has, again, forced us to rethink our methodologies for research. Again, we now have to do innovative hybrid type of research that's very high frequency, because we actually need the data very fast. Because as you said earlier, what the narrative yesterday might be different again to the narrative today. So again, one thing is that the work of UNDP in terms of the methodologies that they use is very important also, to be able to come up with these very important insights and policy recommendations. Again, in terms of the output of the study, in terms of the findings of the study and the recommendations of the study, I think the very practical and very important is, again, the segmentation of the population. Look at the 4 quadrants, look at the 7 segments, and again, looking at these 7 segments spatially across regions, and again, also inside the region. So again, you have these 2 dimensions that, again, certain regions might have more skeptics, more easy segments rather than the rest, but also within these regions, or even within cities and municipalities, you have also a mix of this. There's just some dominant population segment. I think this is very, very important, because this can inform the strategic communications interventions of both the IATF and the National Task Force. In fact, we've already done sessions with the Stratcom group of the National Task Force. And again, they look at these conclusions very well. and again agreed to look at their communications plans and strategies to incorporate all of this. And it's very important. Now, I think one important thing to remember is that, again, as we were saying earlier, and some panelists said it, na access is very important for now. But again, once we do that hump, once we do majority, we're approaching majority, then again, it's important to look now, what are your strategies so that when you reach that hump, we know how to deal with the latter, with the pragmatists, with the remaining pragmatists, what to do with the complacent and the obligated groups. Yung skeptics siguro mahirap yun baka. But in terms of the effort, because like we don't like the United States is a very important example that they went to 50 and then now they're having a hard time. So again, it might be easy for us given that we have and the schedule of vaccine, our supply, it might be easy to reach that hump to go to 50% over the next months. But beyond that, we might have difficulties. I think very important for us is that this study helps us to already at this time anticipate again difficulties, potential hesitancy issues, and again craft our strategies to address those. Back to you, Dr. Karandang.
Thank you, Asek. You point out here that really we are in a situation now of insufficient supply of vaccine. That's correct. But we also need to anticipate, what if in a few months from now we have enough supply, but there aren't enough people who will want to have themselves vaccinated. So I like that forward thinking, that we actually have to anticipate already the time that we now have enough supply, but there aren't enough arms which are being offered to us to actually vaccinate. Thank you, Asek. Can I move to Doc Pons? As USEC has already showed, and as you know yourself, that vaccine acceptance has been increasing amidst the challenges of the global vaccine supply and all the noise. We have so much noise, Dr. Pons, as you and I know, including from health professionals. And how do you think the DOH can use data and data science to help us in the design of communication strategies to further encourage COVID-19 vaccination? So how else can data and data science help in our work for the design of communication strategies?
Yeah, thank you, Dr. Nina. First, I think we need to take into consideration that while these new data come in, there has to be this discipline on how it can build onto our existing framework so that we can provide actionable recommendations both at national and local levels. So as what Dr. Ligot showed, they can help consolidate and analyze both internal and external data from the department and then deepen the insights. One concrete example is the messaging on testimonials, promotion of hope. We've done it earlier in the pandemic, earlier this year. But how do we refine that message as shown by the insight from the analysis, and also refine the triggers? When do we move from one messaging to another to fit the specific segment's needs? So I think that's the first way forward. Determine how the additional data can build on the framework so that it can strengthen our messaging. Second is, how can we enable our local counterparts to be able to use the same data? So the framework has to be relevant to them. As mentioned, the segmentation exists within provinces and then within the priority groups in those provinces. So it should be able, our local counterparts should be able to understand that and be able to navigate the different vaccination positions as supply changes, because a lot of this can be changed in an instant when, like you said, it's possible that we may have incoming supply and then the problem of people not wanting to get vaccinated, even if supply is there. So I think that's crucial. Aside from how the data can add on, how can we make it relevant to the local counterparts so that they themselves can be able to use it and respond in time.
Okay. Thank you, Dr. Ponce. I just forgot to mention also, I'm a methodologist. And like ASEC Carlos, I had to change my methodology in the lockdown. And I've done interviews of pediatric TB patients wearing full PPE. Can you imagine that? A social scientist talking to pediatric TB patients with rifampicin-resistant tuberculosis wearing full PPE. I've never done that in my life. And I remember all the reasons why I did not want to become a physician. It's so hot inside that PPE. And again, you have to also change the ways. So we're now doing FGDs online also. But we're also cognizant that switching to the online platform also disenfranchises those without access to social media and the internet. And Dr. Regala's point about capacitating also our local partners to be able to use this data and the data science insights. How can we actually do that? For example, in areas where there's no internet connectivity. How can we do this with our usual face-to-face? A lot of our health promotion work is done face-to-face before the pandemic happened. We actually talk to the mothers face-to-face in small groups. The fathers seldom come, okay, for any of our health promotion campaigns, but the mothers do, and the grandmothers too. So again, the changing dynamics of safety also and of health and of the epidemic challenge, how we actually approach it. But I'd like to flag the issue also of lack of access to social media, lack of access also to internet. So probably data science also might have its limitation for those people because they are not participants in the different surveys which have been cited. Thank you. How about for Dr. Mutasa? You have a very wide portfolio where you handle East Asia and Pacific region. In your view, looking at the experience, especially of East Asia and Pacific countries, what are the key factors for successful vaccination programs that you have seen, Dr. Mutasa?
Thank you. So let me just begin by putting a clear caveat before I sort of like highlight some of the important success factors. And the caveat being that there's no sort of like one pathway to a successful vaccination program. And why? This is because, as you rightly said, Dr. Nina, contexts will differ from country to country. And then secondly, contexts will also differ from region to region when you look at the Philippines. So as such, it is really important for the government to pay very close attention to context-specific data, as well as to the issues that are coming from different regions of the country in order to effect mid-course corrections to the vaccination program. Because without effecting mid-course corrections, it will be very hard to successfully implement this program. One region, maybe let's say maybe NCR, there would be a need maybe to adapt so that we can target one particular audience that's not responding very well in terms of uptake of the vaccination program. However, let me just allow me just to highlight 5 important lessons or points that the Philippines could learn from other countries, not only in East Asia, but also globally, if you allow me. The first
Please
one,
go ahead.
Yeah, the first one is that, as everyone has said, evidence matters. So let's just say it has to be evidence as we go forward in terms of informing the vaccination program, particularly in light of the evolving nature of the virus, new variants, as well as also the evolving knowledge on some of the vaccinations and vaccine regimen. We all know very well that most of the vaccines that have been rolled out were developed at record speed, and we still have to continue learning from that. So evidence is going to be very crucial as we move forward. Another part, of course, within the context of realm of evidence is the fact that we have seen many countries now sort of like grappling with the need to mix different types of vaccines, as Yusuf Behere mentioned in a presentation. We have seen Canada, Germany, Thailand basically sort of like adopt sort of like the mix and match approach in terms of use of different vaccines. So evidence is going to matter. That's lesson number one. And it's very good to see that the IATF really sort of like tries as much as possible to utilize expert inputs, expert evidence. And I've had the privilege to sit in some of the IATF meetings, and I'm really pleased to see this. If anything, as we go forward, it's going to be even more important to use evidence as much as possible. And very quickly, the second lesson is on the importance of early engagement with the private sector. Here's why it matters. Private sector, as we have seen, has played a very crucial role in rapidly ramping up the production, procurement, and in some countries, actually distribution and supporting delivery of vaccines. I remember one of the panelists basically mentioning the fact that access remains an issue for about 29% of the population. And it might not be the public sector that is well positioned to expand access to those 29%. It could very well be an NGO. It could very well be a private outfit that really can roll out a mobile outreach vaccination facilities to target some of these populations. So I just want to highlight and underscore the importance of the private sector. Just giving you a very concrete example, when you look at Lebanon, a country in the Middle East, they basically have embraced working with the private sector, particularly on what we call the end-to-end delivery support, basically to cover the last mile and overcome the last mile implementation challenges that most countries would experience by basically partnering with vaccine manufacturers as well as with the private sector, which actually has augmented their cold chain capacity. It has augmented their cold chain and logistic capacity. So it is very important, I think, that the Philippines would also build on this, but also just to note that the Philippines, the Department of Health is already embracing the private sector, particularly on the rollout of the Moderna vaccine and other vaccines that require cold chain capacity. Third point, and very quickly, is on the importance of continuing to explore innovative solutions to reach the unreached or the hesitant groups. So I'll just give an example, which might be totally irrelevant, which is from Ohio, the state of Ohio in the US, which basically has rolled out incentives for the initially hesitant populations to get vaccinated. And there's a study which actually has shown that that sort of like a vaccine lottery has actually enabled the state of Ohio to save $60 million in hospitalization-related costs by averted hospitalization and averted severe cases. So yes, there might be concern with the fact that incentives might be expensive, but when you look at the overall economic benefits and the cost return of it, it might actually be pretty significant. And also just to highlight a very good example closer to home, which is in India, where the government of India is exploring the use of electronic health vouchers to increase the vaccination amongst the vulnerable groups. And they're actually doing this working with private sector corporations who are basically contributing this financing as part of their corporate social responsibility. So why not think about this, something like this in the Philippines, together with the Philippines Chamber of Commerce, think of an electronic voucher program that basically targets some of the regions that we saw on a professor's presentation, and basically sort of like roll out this incentive mechanism, and then maybe look at how the results would pan out. The fourth point is basically on, and this is very, very important, particularly in the context of variants that we are living in right now. This fourth point is basically on the importance of linkages between vaccination and COVID-19 testing databases. And why is this important? It is because this is one of the, if there's a linkage between the vaccination program database as well as the COVID-19 testing database, it will enable the DOH to be able to quickly understand the magnitude as well as the nature of vaccine escape, or what we call breakthrough infections. And as we have seen, for example, in Thailand, there's been a proportionate outbreak of vaccine escape, particularly amongst the healthcare workers. And the government basically had to roll out a booster dose through Pfizer, basically to vaccinate that cohort of healthcare workers. So I think it's quite important that the Department of Health thinks through and looks through the possibility to strengthen the linkages between the vaccination database as well as the COVID-19 testing database, so that we can keep an eye and stay on top of vaccine escape data and vaccine escape issues. Allow me to highlight my last lesson, which is very, very important, which is basically on the importance of the Department of Health, WHO, the UN, and everyone, basically to mount agile behavioral communication interventions. And what do I mean by agile behavioral communication interventions? These are basically interventions that are totally outside of the box, that can also reach those families who might be hesitant, who are in the remote parts of the Philippines, to be able to get the messages with regards to the COVID-19 vaccine. And why is this important to have agile communications? I'll just cite this quotation from Dr. Tedros of the WHO, which basically he mentioned that we are not just fighting the COVID-19 epidemic or pandemic, we are fighting an infodemic. And that there's actually a reality in many countries that fake news is basically, fake news about vaccines is basically spreading faster and more easily than maybe the actual virus itself in some parts of the country. So we really need, I think, to mount, I think, a race against this spread of fake news, against the activities of the anti-vaxxer community, so that we can really sort of like be able to communicate effectively on the safety and effectiveness of the vaccines that are available. So I'll stop here with these 5 lessons. And I really would just like to highlight, say, I think the Philippines actually has got a very important lesson that the world could learn from it, which is basically on the digital vaccine certificate, which actually, based on our research in the World Bank, we've seen that the Philippines, outside of maybe the EU, is one of the few countries that has really paid very systematic attention to the development of the digital vaccine certificate, which is very, very crucial, either for isolation or for monitoring of the movement of the vaccinated population, as well as for it to effect smarter quarantine, as well as smarter tracking mechanisms, particularly for those who would not have been vaccinated. So let me stop here. I know I talked a little bit longer, but I hope I did not crowd out the other presenters who are yet to come. Thank you, and back to you.
Thank you, Dr. Matasa. Before we discuss your insights, I'd like to call on Assistant Secretary Carlos Abad Santos, who has to leave very shortly for our congressional hearing. ASEC, any parting words for us po?
Thank you very much to, again, UNDP for organizing this webinar. It's very important to again have the evidence-based, the evidence for good and timely policy making. And we'd like to thank UNDP for again having this facility and again spearheading this study. I'd like to thank the speakers for very incisive points, and I'd like to thank the panelists for again sharing everything. Again, we are here. We've been here for more than 500 days, and I think there's still a lot to be done. And again, a lot of this work that we're doing, especially vaccination, which again is a very important strategy. I mean, you have PDITR and it's now PDITR-V strategy. That's equally important. That vaccination strategy is equally important. And then as part again also as the lead for the cluster on recovery, the recovery cluster, I think it's so difficult to look at recovery, to plan out recovery if we are still in the midst of response. So again, we feel that vaccination will really be a game changer and an important milestone for us to be able to go to recovery and to the new normal. So thank you very much, and back to you, Dr. Nina.
Thank you, ASEC. I'd just like to inform you, it's my colleagues who prepare the living CPGs, living clinical practice guidelines for COVID-19. So that's in my office. That's our contribution to the evidence base. Thank you and good luck with your congressional hearing. So Dr. Matasa, you raised very important points. Really, private sector, the Philippine government could do a little bit more of that. But I'd just like to address your point about the unified database. As Dr. Pons knows, I've been harping DOH, where is the DICT database that they have promised us since we started the pandemic in March last year, over 523 days ago. It still isn't there. And unless we have that, we don't have enough testing, tracing, treating, then we really are quite blind as to where we are going. So thank you. I'd like to proceed to June. June, as you know, the communications focal point for the EPI of WHO, and like what Dr. Mutasa and ASEC have highlighted, evidence-based science and policy recommendations are key for the design of any communications program. In your view, how can the Philippines further enhance vaccine literacy through its health promotion and communication campaigns? Any insights on this, June?
Yes, I think what we have seen and what we are starting now in this webinar is we're seeing the importance of gathering the key stakeholders in our crucial role in making sure that our messages resonate, especially at the local context, recognizing, of course, that it's not just messaging which will drive behavior, but also community engagement and social mobilization. In terms of messaging at this point, we could not simply give out information and expect people to understand and take action. As mentioned by the other speakers earlier, we're in a pandemic. We're in an infodemic, actually, and there's a lot of mental noise taking place. Our messages have to cut across, and that pandemic fatigue is also real. So people are also grappling with what information to take in and make relevant to their own lives. So I think in this process, which has been done by UNDP, we're seeing here that communications work is not just the job of communications persons anymore, but we need to take on expertise from various stakeholders. We need intelligence from the ground, of course, from our local government units, finding who are the crucial communication touch points, what messages would be relevant. Data and evidence is very important towards driving insights. We need data scientists to allow us to make sense of all the surveys and the polls that we have been conducting, making sure that these are also triangulated with the non-traditional sources of data, for example, mobility data, so that we can make the best sense out of the evidence. We need the insights as well from behavioral scientists so that we can frame the messages better, make them more resonant, contextualized, culturally sensitive, and with empathy, consistent with what we believe in as Filipinos. There are other aspects of the communication cycle which need to be strengthened as well, such as monitoring and evaluation to ensure that our messages are recalled and that people are aware of the messages, and that important actions are or behaviors are being driven by these. And of course, we need, as mentioned before as well, the crucial role of the creative side of communication. This is where private sector can come in to make sure that messages are packaged in a manner that catches attention. Because pandemic fatigue does not just affect the health sector or people. Even in the communication side, we're having fatigue as well, and we need a lot of creative insight to drive our communications across. The challenge, of course, is we're in an ever-evolving situation, and we need to bring together and optimize how we can exchange across these different stakeholders and optimize that proactive communication. But again, I'm just speaking on the messaging part because a large bulk of the work really is on, as I mentioned and prefaced earlier in this discussion, is really on contextualization, and a lot of the efforts and the capacity needs to be built at a more local level to understand social data and make sure communications is and social mobilization is being made more relevant, especially in reaching the groups who are the usually unreached and usually are the hesitant ones.
Thank you, June, for driving home, again, the importance of stakeholder engagement. And who your stakeholders are, as we know, evolves as the pandemic goes along too. So people probably, or groups who were silent before, are silent no more. They're taking probably another tactical position, okay, as the pandemic also evolves. So the cultural sensitivity, the empathy, I think are all very important. I just like to share also with the group that I developed a few months ago what I call a Pulso framework. Pulso is the Filipino for pulse. My Pulso framework for vaccination, and it says, love kita, halina at magpabakuna. So I love you, come and let's have yourself vaccinated. And it starts with first a conversation. What's the pulse of the group? And then finding out their questions, their queries, their concerns, their angst. What are their concerns? What's their beef? What's their issue? And then discuss with them through dialogues. And then lastly is to embrace them, not physically, okay, but at least acknowledge that you have heard what they were saying, that you want to try to understand it better. And I always say that vaccination is an act of love for yourself, for your fellow men, for your family, for the other passengers in the jeepney. It's also an act of solidarity with other Filipinos and the global community. It's also an act of citizenship. As a Filipino who will owe millions of pesos due to the vaccination campaign, might as well get myself vaccinated because we're already heavily in debt anyway. So that's my Pulso framework, because I want us to have a vaccine literate and a vaccine protected public. And I always end up with encouraging the population to get ourselves vaccinated if eligible and when the supply is available. So hopefully we will get to that point in time where there will be a stable vaccine supply and people actually have a choice. Okay, so that for me are always my messages. Can I turn it over to Ms. Balaan for the Q&A?
Thank you so much, Dr. Nina. And just to echo one comment at the comment section, it is a good narrative to convey vaccine as a gift of love. You know, to protect yourself is also to protect everyone around you. Now we have a bit of time to for the question and answer portion. Given our limited time, we apologize in advance if we will not be able to accommodate all of the questions submitted. But rest assured, we will be answering them and including them in the newsletter that we will be circulating after this activity. So we've chosen a number of questions for our panelists. The first question is, in another study conducted, noted that in the rural population does not believe about COVID because of the low cases. How do we communicate about it in the rural population? So how do we make it more palatable, more understandable to those in the rural areas?
Where there are very few cases of COVID. So how do we convince them that COVID is real? Therefore, vaccination is important. Any suggestions from the panel? I'll throw it to Pons. Pons, you served a long time as a public health doctor and also in a very poor province. What are your insights for this? How do we convince people that COVID is real, therefore vaccination is needed?
Yeah, Dr. Tina, I think the first is we need to show the risk. I think what we did earlier is we showed how COVID affected other areas. But I think the missing link there was how will it affect them, the LGU or people in those areas actually experiencing the low burden, even if you show how it's affected other areas. So it's not enough that you show how other areas initially having low burden, then experiencing a surge because nobody got vaccinated, people were complacent. So, and then relate it to their own context. In some areas, it could be, the main driver could be participation in the local economy. In some areas, the main driver could be they want to go back to school because online school is so difficult, not just for the parents, but also for the kids. So if we link that, we show the risk in other areas, but then determine and hammer down on the local issue that is relevant to them, then maybe we could generate more uptake for our vaccines.
Okay, those are very good insights, Dr. Pons. A local context. What are they problematizing at the local level? What is the most concern for them? And then bring in the conversation. Other insights, June or Dr. Mutasa? How can we convince people that COVID is real when there are few cases and therefore they don't see the need for the vaccine?
Let me come in. I'll just highlight that part of the underlying problem has been that the initial first generation communications on COVID has really sort of like reached people like you and I, who basically use mainstream media. Like we're on internet all the time, on Facebook, we're on radio and all. So I think the key part is to think about how do these people get their messages and where do they get their messages from? And I think if we figure that out, then I think it's going to be very crucial that I think we engage through those local level platforms where these rural communities get their information. Second and more important is also the language of the information and the material that has been used and disseminated. So I think if we think about that as well, in terms of can we translate as much of the DOH's communication to all the local languages, particularly where there's higher vaccine hesitancy, that might make a difference. My last point is basically the importance of what I call boots on the ground, whereby we know that, of course, for people like you and I, Professor, we don't really need someone to be knocking on our door because we have so much an overflow of information through so many platforms. But the reality is, in rural areas, there is very little information. And some people, the only way they get the information is by a peer educator really walking into their household or into their neighborhood and really communicating the message. So I'll stop here. I think we need to think about boots on the ground. We need to think about local languages, and we need to be very clear on how do these communities and where do they get their source of information. If we can figure that out, I think we'll be closer to a solution. Thank you.
Okay, thank you, Dr. Mutasa. June? Nakamute ka, June.
Yeah. Apologies, Doctor. I was answering a question in Q&A. Yes, I think in terms of raising risk perception, this is where stories would be of utmost importance. We've been seeing a lot of numbers being reported at the regional and local levels, but we need to consider as well that each of these figures have their own stories. And if you can tell one relatable story, what incomes we considered as the identifiable victim, one which the community can relate to and know that the risk of COVID is real, the risk of not being vaccinated is real, and the benefits of being vaccinated in terms of one's own health and even beyond health is real, and communicate that story through various channels depending on what would best resonate within communities, then that's one way of increasing one's own connection with the reality of COVID-19 and the benefits of vaccination.
Thank you. So relatability is important. The channels of communication. What's the problematic in that particular locality? What really bugs them? What gives them joy? What angers them? Let's find it out and let's try to strike up a conversation. Thank you. Back to you, to Ms. Balaan.
Thanks. Thank you to our panelists. I think we have some time for one last question. How do we approach provincial and local leaders who have been vocal about solutions that are not based on science? Their stance have been used by vaccine hesitant citizens and has a tendency to harden their stance. Okay, over to the panel.
Thank you. I was asked that yesterday in the webinar also, but I will not answer. Pons, Doc Pons, anong sagot mo doon?
Yeah, our approach has always been to engage them in conversation, because what we need to understand is the motivation behind the position. And these same motivations may also exist as doubts and anxieties of the other citizens. So what we do, we encourage our communicators on the ground to engage them in conversation so that the other detractors are comfortable enough to share the hesitancy and the reasons for their motivation. Then that's when we act. No, can we respond with facts, or maybe it's just really addressing another source of their anxieties. sometimes it's not just the facts that will move people to change their minds. A second approach that we do is once these information are picked up, we link to locally acknowledged influencers. So this can mean professional organizations. This can mean the church who can help verify and reinforce the messaging that the department is moving forward. So for example, when we had an issue about hypertension, we coordinated with the society to help us to issue a statement that could help reinforce our messaging. The same thing, we have something ongoing about a certain priest sharing information that could be taken out of context. So we reach out to our CBCP to help reinforce vaccination. So I think engage them still in conversation. And second, enlist the help of our other acknowledged influencers on the ground so that we all say the same thing.
Okay, thank you, Pon. So it's really constant engagement and finding local champions who can also connect with the local leaders. June, would you like to add something before I go to Dr. Mutasa?
Yes, I think Dr. Fonsi already gave a comprehensive response to that based on his own experience. And I agree as well that first that we would need to reach out to that particular person, but at the same time we balance out our efforts, that we also need to strengthen pro-vaccination messaging, for example, and that we gather more allies to strengthen the messages from our side. So I think both efforts need to be done.
Okay, so let's not be detracted also by the noise, no, June, that's the bottom line. And we need to be steadfast against all of the attacks, which the past week has seen a lot. Okay, Dr. Mutasa?
I think the two panelists have really sort of like addressed this question adequately. The only point that I would add is that based on the social experiment study that we just conducted within the World Bank, we see the power of celebrities in the Philippines. And so part of it could we also work through these celebrities to engage with some of these local leaders and really also try to use the star power of these celebrities to convey the messages. Because we see on this social experiment data that some of the people who are initially not decided about vaccination tend actually to be willing to be vaccinated if they get their messages through some of these celebrities. So this is the only point that I would add. Otherwise, Dr. Pons and Dr. June have nicely addressed the key issues. Thank you.
Thank you. So also finding trusted people who can also carry our messages across positively. But my last thought on that is that engage and engage more. It's absolutely tiring, but when we stop, then they gain more fuel, actually. But also not addressing them head on because it antagonizes a lot of these different people. So Ms. Charlene, do we have other questions or that's it?
That's it for our Q&A portion, Dr. Nina.
Okay, thank you, Charlene. I'd like to ask for last messages from Dr. Pons first, Dr. Mutasa, and then from June. Dr. Pons, anong last message mo?
I think we really need the help of all our stakeholders, not just from the government, private sector, but also our development partners, so that we can consolidate and sift through all of these data into actionable recommendations. And I also like to highlight that while we examine our hesitancy issues, the layer on access should also be incorporated. And then lastly, how we can bring in our local stakeholders, not just as implementers, but also as planners and users of this data, because agility, I think, is the key in this pandemic. And they won't just be able to, they're not there just to implement what the national department says. So I hope we can build their capacities also to utilize this data. Thank you.
Thank you, Dr. Regala. Can I switch over to June?
Yes, I think we're in a very special time in history where a lot of focus is really on immunization. And I think we can take advantage of this time such that by driving a whole of society approach and looking at different partners working together, we can drive towards trust in vaccines, and not just trust in vaccines, but also in the health system. Because in the longer run, it's really the trust which is our currency in public health communication, in delivering services, and making sure that people accept our services. So I think it's an important time in the history of Philippine public health. At the same time, this is also an opportunity for us, what we have discussed this afternoon, to be proactive in terms of our messaging, in terms of our communication interventions, in terms of social mobilization, taking note that in the near future, we might be seeing some pockets of those who have lower hesitancy, and that we would need to address them right away as early as possible. And from the WHO side, vaccine acceptance is, of course, a shared interest with the UNDP as well as with UNICEF, and we look forward to further work with you in this space. This is an exciting space as well, looking at these different UN agencies, gathering our forces such that we can address this, as we've mentioned, not just a public health problem, but also a social issue as well.
Thank you, June Urbina from WHO. Dr. Matasa?
Sure. Thank you so much to UNDP colleagues for organizing this meeting. Really a pleasure to be contributing to this very important dialogue, and to our DOH colleagues and to WHO. So I'll just conclude by saying that, look, whether we like it or not, we're living sort of like in a special time where we're caught in this race between quickly and effectively vaccinating our populations and the emergency of new variants. So I think it's a race that we have to win at all costs, or else I think this could actually be sort of like be defining for the generation of our time. So I think as we go forward, in order to win this race, it is crucial that we continue, particularly as partners, UNDP, World Bank, WHO, to support the Department of Health and other government of Philippines agencies to generate evidence so that as the nature of this problem of the COVID-19 pandemic evolves, we basically generate real-time evidence and feed it into the DOH, and much more importantly, also feed it into the healthcare workers who are on the front lines of the fight against this pandemic. So I'll basically stop here, that I think we're caught up in this race that we really have to win at all costs. And I think a key part of the weaponry in that is basically the use of evidence. And I think as partners, we really have a unique role to support the government of the Philippines to generate evidence to stay ahead of the game, and more importantly, effectively and quickly vaccinate the population against COVID-19. And thanks again to Dr. Nina for this very nice moderation. I look forward to meeting you at some point. Thank you.
Thank you. Thank you to our panelists. Now, can I switch roles? I actually want to also give my last message. And while we've been talking about vaccination, we do have other measures, non-pharmaceutical interventions. And in Filipino, hawak natin sa ating mga kamay. No? We don't need to go to a vaccination center to have this. So the consistent and proper use of face masks and face shield, and I always say that the face mask is not a necklace, the face shield is not a headband or a hair accessory, needs to be used correctly and consistently. Physical distancing, I'd like to call WHO's attention because they were the ones who perpetuated the wrong term, social distancing. We should be socially connected, but physically distant. There's a big difference between that. I'm glad they finally listened after many months and they corrected themselves. Good ventilation is important. Limited time of face-to-face interaction is also important. Hand hygiene is also important, difficult as clean water sources are. And also good information hygiene. If we have all of this, plus we're fully vaccinated, then we have a chance to emerge from the pandemic together. And I'd like to end our discussion by picking up on my work on kagalingan or well-being. Kagalingan sa kalagitnaan ng pandemya. So well-being in the middle of the pandemic. We have an ability to adapt to the different changes. So kagalingan or well-being is a constantly changing process through which we as Filipinos adapt and thrive and regain a sense of well-being or kagalingan in the face of various challenges and stressors: family, workplace health, workplaces, finances, and so on. And let me end on the note that health is a human right. I do not owe any politician for my vaccination, because it is also my right as a citizen to access the vaccine. Thank you very much for the opportunity given to me by UNDP, NEDA, DOH, and the other partners. I turn it over again to our host. Salamat.
Thank you so much, Dr. Nina, Dr. Nina, for such a fruitful discussion, and thank you for the masterful moderation, ma'am. We also, again, thank our panelists for taking the time of this afternoon and sharing your insights about this very, very timely and important matter at hand. At this point, we would like to invite Mr. Collins Christie, the president of the Analytics Association of the Philippines, to provide a very, very brief insight, a short synthesis of the presentations and the panel discussion that happened. Over to you, Dr. Christie.
Thank you very much. First, I would just like to, on behalf of Analytics Association, our Board of Trustees, thank UNDP and the FinTech Lab for inviting us to participate in this amazing session today. I have quite the challenge because I'm a big fan of talking about high resolution discussion and conversation. I love long form discussions where we can really operate at high resolution. And I think that has really been true today. And so I find myself in the position now of sort of giving the low resolution summary to a very complex subject. So I'll do my best. Let's see if I'm up to the challenge. I think it was really great to, I'll just sort of summarize the journey we've been through over the last couple and a half hours, starting, of course, with Dr. Salva sharing the current status in the Philippines and introducing the reason why the study was undertaken and the relevance and importance. And then, of course, the excellent message from USEC, Vergara, from DOH. She gave a really great summary of the current status that we have today in the Philippines. And then, of course, emphasized the PDITR plus vaccination strategy, the framework that they're following, and why that's important. And I was really, of course, glad to hear her end her talk with the message of data-driven decisions. Of course, we at Analytics Association of the Philippines always appreciate anyone advocating for data-driven decision making. So I think that was great. And then Doc Ligot, of course, we like to say our very own Doc Ligot, because he's also on our board of trustees at AAP, gave the report. He outlined what the questions are that the report addresses in terms of trends, in terms of barriers, facilitating factors, and then, of course, moved on to talking about the importance of understanding the segments. So some very good data science and data analytics work, I think, from Doc in terms of that. And then specifically, he identified seven demographic segments, and then introduced the idea of the targeted and tailored messaging, which then, of course, I was very pleased to see was really quite widely echoed in the panel discussions in terms of the importance of this, not one size fits all, not mass media, but very targeted, very tailored messaging against the specific segments because of this notion of one size fits all. He reminded us of this importance of this concept that's well known, I think, in the tech industry, in the tech sector, where I come from, which is the crossing the chasm, concept. So it's really great to see that notion, that framework being applied here. I think it's highly valuable. It was somewhat optimistic to see the data that he described that shows we're sort of very close to that sort of conventional number where we're at that chasm. So this is a very critical period of time that we have right now. And then, of course, we moved on to the panel discussion, which I wish I had a long time to summarize because it was a super high res and super discussion and so excellently navigated by Dr. Nina. I really appreciated that. It was just really awesome. And so I think there's some of the very brief summaries, from NEDA, from Carlos Santos, ASEC of NEDA. He stressed the fact that communications are very important. So I think, again, underscoring what was shown by the study. And I really liked his notion of high frequency data. I think that was really, really a great point to make here. And with everything in such dynamic change, decision-making, yes, can be data-driven, but it can't be based on stale data that's no longer relevant, and these things are changing so rapidly. So the high-frequency data, I think, was really excellent. And then Governor Dax talked about the importance of vaccine equity, and I think really just underscored the importance of engaging the LGUs and how vital a role they play here. We all know how important the LGUs are here, and getting down into the neighborhood level and the consistency of the messaging and the storytelling. We at AAP often put on webinars around data storytelling as as a skill. And so here again, it's excellent to see that these concepts are very important. And then from DOH, from Dr. Vergara, Dr. Fons, he also underscored no one size fits all. He also underscored that the concerns are evolving. So this ties nicely into that notion about high frequency data, because things are evolving and changing very quickly. And then he made a very important point, I thought, about the need to integrate the data that's coming, including the data from this new study, into the existing frameworks, because that's how the study will actually bear fruit. If we can take this information, integrate it into existing frameworks and platforms, and then it actually truly does drive the messaging and modifies the messaging, and there's learning that takes place in terms of the messaging, then I think the time and effort put into the study, is great. It will bear fruit. WHO, June, brought the perspective and experience, of course, from WHO, who have been dealing with pandemics, not just now, but for a very, very long period of time, and have just a wealth of knowledge, and also underscored the importance of gathering the key stakeholders, and talked about the challenges we have with pandemic fatigue, and the infodemic notion that was spoken by also Dr. Mutasa. And then it's great to have, actually, Dr. Mutasa, it's great to have you here from the World Bank. And you also validated that the results that were presented by Doc are consistent with what you are seeing at World Bank. So that's comforting to know, that there's some consistency in the insights that are being drawn. And so that's quite validating. And then I thought that your 5 lessons that you laid out are worth just repeating in summary form. I think you talked about, number 1, evidence. You talked about number 2, early engagement with the private sector. You talked about number 3, being innovative in solutions in reaching the hesitant population. So the notion of innovation. And then number 4, you talked about the very important need to link the vaccine messaging and the vaccine study data with the test results as well. And especially that we don't lose sight of this really, clear and present danger in front of us of vaccine escape and breakthrough cases, right? I think, around the world, this is a challenge right now. And then finally, you talked about agile behavioral communication intervention. Same notion there. So I love the recurring theme that was coming up in the panel of this notion now of agile communications, the notion earlier from DOH about high velocity on the data. And let me see, I hope I didn't miss out on anyone. I took lots of notes, and I know we have limited time, so I think I'll probably leave it there. I hope that many people will watch the replay of this video. I hope the policymakers and the media and all the various stakeholders will really move to this high resolution thinking on this issue. And I think that's what hopefully we're all here to advocate. So again, I'll wrap there and thank you very much for including us.
Thank you so much, Collins, for your best effort in summarizing such a packed and insightful discussion. That I'm sure that wasn't an easy task. And rest assured, we will be sending out the recording, a copy of the recording of this webinar to all of our networks as well, including all of the copies of the presentations and the reports. To formally close our program, I will now turn over the floor to Ms. Yemi Werkey, the Senior Policy Advisor of UNDP Philippines. Ms. Yemi heads the Impact Advisory Team, which is responsible for policy research, partnerships, and pipeline development, and which also houses the Accelerator Lab and the Pintig Lab of UNDP Philippines. Turning over the floor to you, Ms. Yemi.
Thank you very much, Char. Good afternoon to you all. All protocols duly observed. It's a pleasure to be here today to witness such a rich conversation, which brings together really distinguished decision makers, eminent experts, to discuss a very important point of interest, namely vaccine acceptance. I could not thank you enough for the rich conversation that you have brought to us today, and all the panelists and Dr. Nina for her masterful moderation in this discussion, in the presentations that has been shared. Thank you all for the efforts. I just thought I would highlight three important points and we close this webinar. The first and the most important point, which really is being reiterated across by all panelists and then discussions, was the importance of information on vaccine supply, the equitable distribution of vaccine, and the availability of this information disaggregated by geographical area, population groups, which is very, very key for us to really promote vaccine acceptance. We know that the more people are vaccinated, the more people are going to be motivated to vaccinate themselves. The second and most important point I wanted to highlight is the need for innovation. This has been reiterated by every speaker, including Dr. Nina, who's our moderator. Very important that we look into out-of-box solutions for this particular problem that we are dealing with. The delivery of effective communication messages on COVID-19 vaccine is an important task that the government of Philippines has taken seriously. However, it's not very easy as we move forward delivering effective communication in the age of social media. So we really need to heighten our efforts in reaching out to the wider population through innovative approaches. Most importantly, I also took to my heart a very important message that come across on strengthening the capacity of to communicate effectively of local level. And in that, I wanted to underscore that it is important we work very, very closely with all partners to boost the capacity of LGUs to communicate effectively at a local level. This very important point is taking me to the last but also very important point on stakeholder engagement. It is encouraging to see that Filipinos are increasingly wanting to be vaccinated. It's an effort by its own, it's the fruit of the effort. Yes, government is fully responsible for the vaccine program, including vaccine acceptance, but all stakeholders should support the effort of the government in reaching out the wider population. For example, we are very, very aware that the private sector plays a very important role in numerous ways. One, in the strategic communication. Two, even providing incentives to reward positive behavior. So we wanted to encourage more and partner with private sector to making sure this happens. Other stakeholders such as CSOs, women groups, youth groups should also complement the effort of LGUs to reach out to wider population to accept vaccine increasingly. So we wanted to work with everyone here today and then beyond in this particular effort. With this, I would like to say thank you so much, our esteemed guests who generously shared their insights, the participants who patiently engaged and contributed, as well as our partners who have collaborated with us in organizing this webinar. I once again thank you all for your time and your efforts. I look forward to engaging you in the future. I now seize the opportunity back to Char to have a final note. Thank you very much.
Thank you so much, Yemi. Before we close again, we would like to thank all of our distinguished speakers, panelists, guests for joining us this afternoon. And as we tackle this pandemic together, let us keep in mind that we have to work together in the pursuit of the equitable access of vaccines and widespread vaccine acceptance as well. We all play an important role in increasing the trust in the vaccination program and in fighting the infodemic. We can only truly be safe if everyone is safe. And as mentioned a while ago, we will be sending the recording of this webinar and the digital copies of the 2 presentations and the report itself to the email addresses that you use to register for this activity. Once again, this is Charlene Balaan of the United Nations Development Program in the Philippines. Maraming salamat po. Please stay well and stay safe. And I think before we close, I would like to request all of our speakers and panelists who are still with us to please switch on your cameras so that we can take a very quick commemorative photo. Okay, the count of 3. Okay, maraming salamat po. Have a great Thursday. And again, thank you so much, everyone, for joining us.
Thank you. Thank you, everyone.
Thank you and bye.
Thank you. Thank you very much.
Thank you to UNDP, NEDA, and DOH and WHO. Salamat.
Thank you, Dr. Nina. Thank you, everyone.